And welcome. Starting with our top story this hour, with Pfizer announcing promising results for its potential COVID-19 vaccine, governments across the world have started lining up to get their hands on it. The US and the European Union are first in line, signing deals for 100 and 300 million doses each. Japan, meanwhile, has signed a deal for 200 million doses, while the UK has asked for 30 million. The Israel Prime Minister has also tweeted that Israel too is working around the clock to get the vaccine. While India has shown interest in the vaccine, no deal has yet been signed to procure it. Meanwhile, Russia has said that 20 countries have pre-ordered 1 billion doses of its Sputnik V COVID vaccine. Countries which have shown interest are India, the UAE, Saudi Arabia and other countries in West Asia. Meanwhile, Pfizer CEO sold stock worth $5.6 million on the day of the vaccine announcement. The company, however, said that the sale was part of a pre-arranged periodic divestment plan, while Pfizer's shares rose by 15% after the news of the promising results broke. CEO Bourla sold 132,508 shares at $41.94 per share. Volunteers who were a part of Pfizer's COVID vaccine trial, however, revealed that side effects of the vaccine gave them headaches. Other side effects experienced included fever, muscle aches, while some volunteers compared it to a severe hangover. However, more than 43,000 people from 6 countries have taken part in the Pfizer trial. Pfizer and its partner BioNTech are expected to seek US authorization sometime this month. If granted, the companies estimate that they can roll out up to 50 million doses this year.
We are at the moment in a close dialogue with regulators around the world. We are talking to the European Medicinal Agency, we are talking to the FDA, we are talking to Canadian Health, to the UK authorities, to the Chinese authorities, to Japanese authorities. And first authorizations or conditional approvals could happen in the United States or in Europe. But the earliest time point for starting supplying vaccine will most likely not before mid of December. And this mid of December will also not mean that the situation will dramatically change. So we have to expect that this will be really a difficult winter. It will become worse before it gets better. So we will feel the first reliefs in the starting with March, April next year, and ideally we would have a better controlled situation in mid of next year.
And now Chivanda Jimbelu, our correspondent from DW, joins us live from Berlin. Thank you for being with us. Let's start with whether you are seeing any results from the partial lockdown recently imposed in Germany.
Well, we just had the German health minister this morning earlier on German TV saying that they can't really say if they've seen any results from the partial lockdown. What we can talk about, though, is the new record in terms of the number of coronavirus cases reached in a 24-hour period, new coronavirus cases, that is. And Germany now has logged in 23,542 new coronavirus cases. And so that's the highest number ever since the pandemic began. And that's definitely something that is perhaps cause for concern, despite the fact that the health authorities had said earlier this week that the reproduction rate for coronavirus was now at 0.89, which is not as high. That means that people who are getting infected are not as high as the number of people who are sick with the virus. So that's just something that obviously, in terms of, there's some good news, but there's also bad news with that record number of cases.
Right. With that record number of cases, what is life like in Germany right now? Does this go to speaking to how people have responded?
Well, in terms of how people have responded, there is a new poll which shows that about 1 in 4 Germans, actually maybe slightly more because it's 26%, is unhappy with the current measures. They think that they go too far. So the partial lockdown is much too stringent for some people. But the good news from that poll is also that more than half of Germans, 54%, support the current measures. However, of course, with 1 in 4 being against it, then we can obviously understand why some people have been protesting against the current measures. Also, of course, what we do see in terms of education is that it's really hard to keep school-going children in school. The German Teachers Association released some figures saying that 300,000 school-going children were in quarantine, and that's up from 50,000 in September. So, of course, we can only imagine what kind of pressures families are facing to, of course, maybe take care of kids who are in quarantine, because, of course, then parents are forced to stay home instead of perhaps going into work. So there's a lot of questions in the air in terms of what will happen when we hit flu season in winter.
Right, and Chipanda, how does the situation in Germany compare to the situation in the rest of Europe at the moment?
Well, the situation in Germany is not quite as dire as in some other European countries. What we've had is perhaps, a warning on the testing capacity. The authorities say that the testing capacity is at full capacity, almost nearly at full capacity. So that means perhaps not as many people are getting tested. So even the number that we saw, the new record, maybe it is higher if not enough people are getting tested. So that's something that could be concerned. But in terms of IC units that are available, so intensive care units available in hospitals, Germany has more capacity than other countries in Europe, which have, of course, been close to capacity. We can talk about Belgium, whereby we had patients being flown over into Germany to get treatment here. So Germany has about 6,500 intensive care units available, and some 3,300 or so are being used. So there's obviously more available than in use at this point, but there are some hospitals also warning that they're running at full capacity because, of course, healthcare professionals are getting sick. And so that's also a problem in terms of, how do you treat patients if some of the people who need to be treating them also have the coronavirus? And that's something, of course, that is of much concern here in Germany.
Right.